Hey everyone, it's Courtney, the ME Lion, and today I'm going to do a video and answer the question, how did I get my diagnosis? Someone asked this in the comments and I thought, that's a great question, let's do a video about that. So then I decided that I'd go take a shower and freshen up in order to do this video, and that's about all I've got for today. I'm not feeling great today, and I wasn't feeling too great yesterday, so but I decided I wanted to do this, and I'm just gonna keep it real and do it au naturel here. Yes, this is my shower turby twisty thing, and we're just gonna overlook that, okay? So how did I get my diagnosis? I wish that this was more of a straightforward process, but unfortunately it's not. MECFS, and a lot of you are like, what does that stand for? Myalgic encephalomyelitis chronic fatigue syndrome. This is still very much a diagnosis of exclusion, and there's a couple of reasons for that. Does that mean that there is no objective data for this illness? No. There is something called a CPET. It is a cardiopulmonary exercise test. This procedure will objectively prove MECFS. It will prove a diagnosis, and it may actually help you get disability benefits if you are inclined to try. My caution is that a CPET is most likely going to worsen your condition. For me, it was not worth the risk when we were considering applying for disability benefits. My doctor was basically like, you know, you deserve them, but you have a snowball's chance in hell. And then I started looking up, you know, what the criteria might be for MECFS, and I read about the CPET, and I thought, oh my gosh, there's no, like, I can't stand for this illness to get any worse. There's no way. I cannot put myself through that. And when I told my husband what all was involved, you know, he said a few choice words and basically, you know, told him where they could stick it. And so I never really applied. And you know, we're blessed, and we're doing okay. We bought a very small house that we could afford on one income years ago. We buy used cars that we can pay cash for, and you know, we've always tried to live below our means. And so when this happened, we weren't completely devastated financially by it. It was a huge adjustment because, you know, we were depending on my income, and certainly we lost that. So it was an adjustment, but we were able to, you know, sort of weather the storm. So, but anyway, so yes, you can objectively get data to diagnose this illness, but what mostly happens is that you are going to be put through the ringer to make sure it's not other things. They're going to want to make sure that you don't have multiple sclerosis, which is another thing that can take years and years to show up, because you start having symptoms before brain lesions show up. So, you know, a lot of these things are just really tricky, but I had to have all these other illnesses ruled out. So I had to have a lot of different diagnostic procedures done. I had to see a lot of different specialists. And once I kind of ruled out, no, I don't have MS. No, it's not my thyroid. No, it's not RA. No, it's not lymphoma, or, you know, any other type of cancer. No, it's not this. No, it's not that. which, I could have said it's not cancer. I've been carrying this thing around for decades. But anyway, once we ruled pretty much everything else out, then we landed on MECFS. I had known for a few years. I had finally figured it out on my own that was my most prevalent problem. And so, you know what? Actually, hold on just a second. In 2015, the Institute of Medicine, which is under a new name now, the American Medical, it's not the American Medical Association, but it's something else. In 2015, they came out with diagnostic criteria. And so the purpose of that diagnostic criteria was to help doctors and patients expedite a diagnosis. It was to give doctors and nurse practitioners the leeway to go ahead and make a diagnosis so that patients could go ahead and, have some answers and start taking the necessary precautions that you need to take if you have MECFS, because everything that seems helpful in any other circumstance is generally counterproductive to MECFS. If you're feeling weak and tired, exercise more. No, not with MECFS. You'll make it worse. They used to have guidelines suggesting cognitive behavioral therapy and graded exercise therapy, and patients kept pushing back, going, "This is making me worse. This is harming me." And finally, after years of patients pushing back, they have finally come out. They have finally spoken out against those guidelines. Those are no longer recommended. They are contraindicated for people with MECFS. So, yeah, and this is from, I'll link this, I'll look it up and I'll link it below. This is from the Mayo Clinic Proceedings. And you'll probably hear me talk about this article a lot because I think that they just nailed it. A lot of times I read information about MECFS and you can tell it was written by someone who clearly doesn't have it and hasn't had much experience around it. And it's like, that's not quite it. It seems like it minimizes it. But I think this just hit it on the head. I don't know that I could have written it better myself. And one of my favorite MECFS doctors, Lucinda Bateman, she's first on this paper, and she's from the Bateman Horn Center, and I really recommend that resource. A lot of their content is geared towards healthcare professionals. Not all of it, and I still think you can get something out of it. They have a YouTube presence, and so I would look them up, Bateman Horn Center, and if I remember, I will link them below as well also. But it says, in 2015, the U.S. National Academy of Medicine, which was previously the IOM, published new evidence-based clinical diagnostic criteria that have been adopted by the U.S. Centers for Disease Control and Prevention. Furthermore, the United States and other governments, as well as major healthcare organizations, have recently withdrawn graded exercise and cognitive behavioral therapy as the treatment of choice for patients with MECFS. So that's what I was just talking about. And the fact that these diagnostic criteria exist should help you to get a faster diagnosis. You may not have to go through all the rigmarole that I did. This illness hasn't been well known. It's just now kind of getting some traction. So I've had MECFS since about the year 2000, and I didn't get my diagnosis until 2020. So it took me 20 years to get a diagnosis. And this is where I would say, if the shoe fits and you're pretty sure you have this, there are ways to realize if you have this or not. And we'll get into that in a second. If the shoe fits, I would go ahead and proceed as if you do, and I would take the necessary precautions, which would be listening to your body, limiting your activity. You've got to stay within an energy envelope. Your energy envelope is going to be different for each person. This illness exists on a spectrum. There's mild, moderate, severe, and very severe. I went from mild to severe. And I can maybe find those categories and get into those a little bit more in a minute. But I say that to make the point that you can absolutely worsen your condition. It can progress. And those who are very severe are completely bedbound, mostly stuck in headphones, eye coverings, any noise, any light, any conversation, basically any stimulus at all, very, very little stimulus can overload their senses and cause a crash. Things like brushing their teeth, just the most basic self-care, can cause them to crash. They're extremely weak. Some of them are on tube feeding because they cannot feed themselves. So this can get really serious, and I don't want you to make the mistake that I made. I didn't know what I had. No one else knew. And I kept thinking, well, I just have to make myself stronger. I've got to push myself. I've got to get to the gym, and I've got to, and so every effort I was making, which would be beneficial just in just about any other circumstance, made me worse, significantly worse. And I don't want you to end up losing years of your life like I have, okay? So if you have the symptoms, and we'll get into that in just a minute, if you'll be patient and let me kind of flip through here, just proceed with caution and assume that you do, okay? A diagnosis isn't necessarily going to change things for you. Now, it might set you up to be able to apply for disability benefits. If you're someone who really needs to get those benefits, I completely understand. I've been fortunate that my husband has stuck by me. A lot of times people get this illness, and because it's so poorly understood, and because it's hard to diagnose, and because your labs 9 times out of 10 look perfectly normal and you'll be told that you're normal, people will start looking at you like, are you making this up? Are you sure the doctors are wrong and it's not you? And spouses will leave. There are multiple cases of that. And so then people are left without the ability to provide for themselves. They're just as sick as they could possibly imagine. And now they don't have a support system, emotionally or financially or even physically, because there's been a lot of times that my husband has had to bathe me. He's had to help me in and out of the tub. He's had to help me in and out of the bed. He has had to dress me and put my clothes on. Yeah, so this illness, and I say it all the time, I know I repeat myself, but it's absolutely devastating, and you need support around you. And it's hard, luckily I've had my husband, but, and I've had my mom and dad too. They haven't always understood though. And I think there've been a lot of times where they've thought, are you okay? Like, I'm not sure they really got it. And then, you'll have friends kind of fall out of your life. Hopefully that's not you. Hopefully your support system not only stays intact, but rallies around you and lifts you up. I hope and pray that for you, because that's what people with this illness really need. Unfortunately, it's not usually what we get. So, yeah, you may also need a diagnosis to get a handicap placard. I had to break down and get a handicap placard. I found myself, as I was getting worse, I would go to a store and I would park in the parking lot and I'd start walking to the store, and all of a sudden, it's like I realize I'm not going to make it. And you turn around and it's the same distance back to your car as it is into the store. And there's really no one to help you. And you don't want to broadcast that you're weak when you're out in public. And that gets really, really scary. And so I just kind of had to face up to the fact that I was in the condition that I was in, and I got a handicap placard. So you may need a diagnosis for that. And if you have, MECFS usually has comorbidities, and a very common comorbidity is fibromyalgia. Another one is POTS. POTS is postural orthostatic tachycardia syndrome. And so that means that with any positional changes, they can be minor positional changes and they can be abrupt positional changes. Everybody can relate to, oh, I stood up too fast, I'm dizzy. With POTS, you don't have to stand up fast. It's just the fact that you stood up, or maybe you sat up too fast, or maybe you've tried to stand up in one place for too long, or it's just being on your feet at all. Your body has a hard time compensating. Your blood pressure drops and your heart rate speeds up to try to compensate for that. And homeostasis takes a lot of energy. And so if you're dealing with POTS on top of CFS, man, it's a major drain on an already very low battery. So if you've got fibro and or POTS, you can likely get a handicap placard for that. I would ask your doctor. And you may be able to get, I know there are cases where people have been able to get disability for fibromyalgia. It sounds like a snowball's chance in hell as far as I'm concerned, but people have gotten it, so you may want to look into that. That may be slightly easier than trying to get it for MECFS. So let's see here if I can find the diagnostic criteria. Okay, in 2015, the NAM published updated criteria. The new criteria require substantial impairment in function accompanied by fatigue, PEM, which is post-exertional malaise. I've talked about that in previous videos, unrefreshing sleep, and either cognitive impairment or orthostatic intolerance. And most of the time you're going to have both. Symptoms should be of at least moderate intensity and present at least 50% of the time during a 6-month period. Well, by the time I got diagnosed, my symptoms were present 100% of the time, and 6-month period, 20 years. Other important factors include peri-onset infection, which is what happened to me. I had an Epstein-Barr infection and never got back to normal. For some people, it's a respiratory infection. For some people, it's a bacterial infection. Some people had surgery and never got back to normal. Some people had a physical trauma and never got back to normal. So it can be a few different things. Peri-onset infection, widespread pain, and impaired natural killer cell activity. So yeah, they can check your natural killer cell level as well. Additional symptoms include influenza-like symptoms, e.g. sore throat, tender lymph nodes, hypersensitivity to external stimuli, food, smells, light, sound, touch, and chemicals. Yeah, you're not weird. You're not crazy if you're having all those sensitivities. It's part of it, and most of us deal with that on some level. I have dealt with it in a pretty extreme level. Carnivore is helping with that, but it's still there. And I have a sound sensitivity disorder that exists outside of MECFS, so I don't think that's likely to go away. But, I no longer feel like my brain is being pierced if the lights are bright. I still am really sensitive to smells, but they don't set me back in the way that they have been previously. And there were times when my husband he'd be like, "Can I rub your feet? You look like you feel so bad." And and he'd try to be helpful. And as soon as he started touching my skin, my skin was so painful, I couldn't stand it. And, those symptoms are very prevalent with fibromyalgia too. So sometimes these illnesses have so much overlap, it's kind of hard to tell them apart. And I'll tell you how you can tell them apart in just a second. Okay, we just talked about the stimuli, susceptibility to infections, visual disturbances, gastrointestinal or genitourinary symptoms. That means your gut and your bladder. Respiratory issues such as air hunger. I've suffered with that a lot. And thermoregulatory issues. Yeah, regulating your body temperature. So that is a huge issue for me. I'm hoping that that gets better. And so far, maybe it's improved a little bit, but we're about to find out. June is here in Tennessee. The heat's about to really crank up. The humidity's already ramping up, and we'll see. But I still, with the heat in the shower, I still run down really, really quickly when I get hot. I prefer to be cold. I keep my house like an icebox. And I think that being a little on the chilly side causes vasoconstriction. I think that helps with my blood pressure. People with MECFS have reduced blood volume and reduced cerebral blood flow. So I think it, helps with all of that too. When you get hot, your vessels, they dilate. And if you think of your vessels like a water hose, when you've got a wide water hose, right? The pressure is going to be lower, right? If you constrict that, like when you put your thumb over it and you're trying to like spray people or, whatever, trying to make it reach, you're constricting that diameter, vasoconstriction. That's what I mean when I say vasoconstriction, like your vessels constricting. That pressure is higher, right? Does that make sense? So when you get warm and your vessels dilate, your blood pressure drops. And when you've already got low blood pressure, then it doesn't take long for you to get really, really symptomatic of your low blood pressure. And if you've already got reduced blood volume and you've already got reduced blood flow in your brain, then all those symptoms, cognitive symptoms and feeling dizzy and low blood pressure will make you feel just super sick and nauseous and icky. It makes you feel terrible. So yeah, if you're having issues regulating your temperature, that's part of it, because this illness affects the nervous system, and it affects the autonomic nervous system especially. And so your autonomic nervous system is the things that are, it's like the apps running in the background, right? It's your heartbeat, it's your respirations, it's things that you don't have to think about, it's things that your body is taking care of for you. So this illness really impacts the autonomic nervous system. Now, how can you tell if it's MECFS or if it's fibro or if it's chronic Lyme? I happen to have a diagnosis of all of those. And I think that they're true. I think that I used to be an avid gardener, and I live on a very wooded property. And, ticks they're part of it, right? When you're outside and you're in the weeds and you're in the brush and you're doing all that stuff, right? So I think that tick-borne illness caused my pot to boil over. But I was already sick before that. I just wasn't as sick as I am now. So it's like your body tries to go along, it tries to hang in there, it tries to compensate, and then all of a sudden it's like the final straw, right? And it's just like your immune system's like, I can't, I'm overwhelmed. So I think that's what happened to me. And And that's its own like complicated thing that I'm not going to get into. Lyme disease is a real rabbit hole, and I had a physician tell me that Lyme disease is a thorn in the flesh for not only the patient but the physician too. So like nobody really wants to deal with it. But again, it's not been my biggest problem. MECFS has been my biggest problem, and here's why. If you're trying to figure out, well, is it these other things or is it MECFS? There are two defining symptoms that separate MECFS from these other things. Really, there's one, okay? An article I read recently said two, but really, this is the hallmark that you need to watch out for because none of these other illnesses have it, and that is the PEM, the post-exertional malaise. If you are someone and you're struggling with all this fatigue and you've got all these other symptoms. Here's how you tell the difference between the fibro and the ME. Fibro, usually you're gonna have fatigue with fibro, but normally it's more pain centric, where the ME is more fatigue centric. But post-exertional malaise is this really unique misery where if you exert past your energy envelope, all of your symptoms will flare back up, and they will flare back up exponentially, and you will be down. Like, your body will shut down until it replenishes, until it can replenish itself to the point that it can replenish. That's kind of hard to explain, but I like to think of it in terms of like money. If you had $5 today but you spent 10, you're in the hole, and you're getting overdraft fees. Just, they're hitting you left and right until you can get that extra money in your bank account. And who knows how long it takes you to get that extra money in your bank account. And so with MECFS, with post-exertional malaise, it depends on what you did. And I've said it before in other videos that I've had post-exertional malaise last for a few days, I've had it last for weeks, and I've had it last for months. It can really take a while. So, and Dr. Lucinda Bateman, who I spoke about earlier in this video, she and Ron Davis, who heads up a research team at Stanford, they've both mentioned that post-exertional malaise, when you hear people with ME talk about, I'm in a crash, that's what they're talking about. I used to refer to it as the payback. I've done a thing and now I'm paying for it. They hypothesized that you're basically restarting your illness. You're relapsing your illness. So it's really important to pace yourself and to know your limits. And this is something I am not good at. And some people are so sick that they can't help it. They crash just trying to get through the day. And that's kind of where I got to. Now that I'm having some progress with carnivore, my crashes are basically my own fault. And I've talked about that before, that as things change and improve, I don't know where my new limits are until I crash into them. So I have got to make it a very crucial goal to not crash. I've got to make it important enough. I've got to tell myself, if you want to heal and you really want to get out of this thing, you have got to pace yourself. Just because you're feeling better, just because you have some more energy, doesn't mean you can burn it all up. It's kind of like the saying that money is burning a hole in your pocket. Well, energy is the same way, especially when you've just been starved of it, you've been starved of being able to do anything. And so when you get some energy, you want to do the things. And for me, it's normally just like, oh, I've got all this stuff around the house I need to catch up with. I've not been able to do it. And because I tend to be sort of goal and chore oriented and like duty oriented, as far as like my responsibilities around the house and stuff go, I feel like, well, if I've got the energy to do it, I need to do it. I don't want this to be one extra thing that falls on my husband's already extremely full heaping plate, and so I'll get myself in trouble that way. So it's really important to recognize your limits and stay within them. If you're like me and you don't really know where your limits are, tread lightly. It's better to be on the conservative side of things right now and just tread lightly. You're gonna heal faster that way. I put out a video early on saying that around the 90-day mark, I thought that I would try to start walking down the driveway and maybe introducing some exercise. No way. I was way too presumptuous with that and way too ambitious with that. I am not at a point yet where I can entertain exercise. The fact that I can be up and on my feet for extended periods of time, you know, I'm counting that as exercise. At least it's weight bearing, right? At least it's weight bearing, and you're building strength in your bones, and, you know, walking around my house a little bit. At least that's muscle contractions, right? Helping with some circulation. I'm not getting as much blood pooling in my feet. Venous pooling is what that's called, and I've dealt with a lot of that, which is scary. Your feet turn this terrible shade of purple, and it is not attractive. But yeah, so it's a learning process. There's a huge learning curve with all of this. But that's a little off topic. The topic of the video was, how did you get your diagnosis? Well, you know, that's the gist of it, is that you are probably going to have to be checked for everything else first before they land on MECFS. You can pull this article up and take it to your doctor and show them the 2015 diagnostic criteria. At one time, I was able to find that diagnostic criteria, like bullet pointed out in a report from the IOM, and I can't find it online anymore. So it's like something you have to pay for. You know, like it's just for providers now, but it used to be free. I don't know why I can't find it anymore, but you could print this out and show them that there are new diagnostic well, not really new, 2015, right? That's 9 years ago. So that diagnostic criteria has been around for 9 years, which should give your doctor the courage and some comfort to go ahead and make that diagnosis, even though they will want to and should investigate other things just to make sure there's nothing else brewing. Again, a lot of illnesses have similar symptoms, and you're going to want to rule them out. Your doctor is going to want to cover his or her bases and rule them out. So to get your diagnosis, you are likely going to be put through the ringer of many specialists and many, many tests and many procedures, and it's a huge headache. It's frustrating. It's expensive. Maybe you've got really great insurance. We've, up until very recently, been self-employed. And so, you know, most of that stuff was out of pocket, you know, ouch. We have like a health sharing program, and you do get reimbursed, but, you know, it's out of pocket up front. So you have to prepare for all of that. If you don't have insurance, you kind of gotta, you gotta do some planning. A diagnosis is not easy. It should be easier now. And, you know, find a doctor that understands this illness, and they're not the norm yet. You know, they're kind of the exception to the rule still, but they're out there. And if you're looking for a doctor, I would call the office and say, does this doctor see patients with MECFS? And then you'll kind of have your answer. I have to drive 2.5 hours to see my doctor. And normally I'm not able to make the drive, so it's my husband having to take time off work and take me, you know? So it took me a long time to find a doctor that would listen. And is there a doctor in my area that probably understands this condition and sees patients with it? Yeah, probably. But I got so jaded that I really quit trying to even find a doctor. I quit going to the doctor. There years went by that I really quit going to the doctor. And then so the doctor that I see now, he actually sees my mom and dad. And, you know, every time my mother would call, she'd say, Dr. So-and-so asked about you, and, you know, he's concerned, and blah, blah, blah. And then one day I just said, you know, your doctor, he's so great, he's so kind, he's so thorough. Do you think that he would take me on as a patient, even though, you know, I don't live there? And he said that he would, and he's a wonderful doctor, and he's a bit of a unicorn. So you gotta search for your unicorn. I do not recommend finding a doctor that's so far away. That's the situation I'm in right now, and I love my doctor, but I don't really recommend that for you. If you can, if it's at all possible, find someone that's close to you, and find someone that you feel good about and that you click with, okay? And I hope that answers your question. I went a little bit off kilter, but not really. I mean, all this stuff we talked about is relevant. If you guys have any more questions about MECFS, if you want to hear videos that dive deeper into this illness, I'm happy to do them. I have thought about doing a video just called What is MECFS? And I've been trying to think about how complicated or how simple to make it. You know, part of me is like, maybe just do the bird's eye view, and then the more like intellectual part of me is like, well, no, maybe you need to make it a really like involved video. But I don't know. I don't know if you guys really care for me to go that deep, and I don't know if a lot of you that are super sick are gonna want to swallow that. So I think I may just do the bird's eye view, and then I can link articles that go in deeper into deeper detail. No reason to reinvent the wheel. But anyway, that's it for today, guys. Appreciate you being here, and wishing you the best on your journey. I hope you had a great weekend, and until next time, this girl will keep fighting and eating like a lion. See ya.